and the vaccination has been widely introduced since 2006. So it's about 7 years in action right now, and we do not have data yet which demonstrate in a statistically significant way the effect on cancer cells themselves. But since the essential precursor lesions are being prevented, it's highly likely that the same is true for cancer. Duration of virus persistence usually something like 8 to 10 months, and 30% are still positive after 1 year, 10%, approximately 10% still after 2 years. This is a group of women which is at high risk for developing this type of cancer. And we calculate for Germany that about 1.1% of the infected female population will eventually develop cervical cancer. It's about 6,000 to 6,500 new cases, and about 1,700 women die per year. But, and this is an important point also in the discussion for vaccination, about 140,000 cone biopsies are performed annually for high-grade lesions in a total population of 42 million women, and 2 to 7 of them suffer from complications, as indicated by the health insurances: bleeding, obstruction of the cervical canal, perforation of the bladder or rectum, inflammation. But the most important ones are clearly these: a higher risk for premature deliveries, a low weight at delivery of the newborn baby, and an elevated risk for perinatal death. In addition, approximately 2,500 hysterectomies are performed for recurrent precursor lesions, which means in praxis that there's a total of about 150,000 surgical interventions taking place annually for precursor lesions plus cervical cancer. Well, I showed this before. I think we can skip it now. This shows once more the integration pattern, but one should note that the viral DNA does not in all cases integrate into host cell DNA. It persists in some instances episomally, but apparently the viral DNA which persists episomally is no longer able to replicate. It is usually some of the genes are inactivated by methylation, by secondary events taking place in the DNA. This schematically summarizes the pathogenesis of cancer of the cervix, where the infected cell, after some lateral spreading and after several divisions, acquires a clone which has a modification in one signaling cascade which protects, usually probably here, from the presentation of viral antigens or which mediate